When I was finishing high school, I was kind of pretty set I wanted to get into something with medicine, and so I volunteered at my community hospital in Central Ohio, and I really liked what the bedside nurses did. I thought that was a good fit for my personality. I liked being with the patients one-on-one, spending a lot of time with them, so I took that up, and I'd always been interested in the fast pace of ER and critical care. I was an EMT for a while I was in college. I loved the bedside care, but I always wanted to know more, why my patients were sick, what was going on, why we were doing the treatments we were doing. So just sort of a natural progression for me to keep digging deeper, and that ultimately led me to pursue my degree as a nurse practitioner. Well, I do maybe 80% of my work is inpatient, so I'm on a neurology consultant service. So a lot of times the patients have already presented with a chief complaint and been evaluated by a generalist and are being evaluated by us as a referral. I would say the large majority of them being hospitalized patients are stroke, seizure, head trauma, things of that nature. And then my outpatient setting is a couple times a week. I see patients that I have already seen in hospital. So the stroke patients that are discharged from Fairview Hospital, a portion of them come to me in clinic for their follow-up to ensure that they're doing well, they're tolerating their medications. Workup sometimes is ongoing for stroke, so I kind of help them through that process. I think the best thing about community hospitals, having worked at Hillcrest and now at Fairview, is it is a smaller community, and there's that sense of community. I know most of the other team physicians by first name. There are certain ones that I work very closely with. So I feel like the patients, a lot of community patients, the doctors that they see in the hospital are also the doctors that they've probably been seeing for years as an outpatient. That's the most rewarding, is when a patient or their family talks to you, and you know that no matter the outcome, no matter what ultimately happened, they feel that you did the best for them, and that they appreciate the effort that you put into their care.